Your brand new iPhone deserves the best protection, and the iLume 3-Pack Screen Protector Plus 3-Pack Camera Lens Protector has you covered. Don't take risks with your iPhone. Click the link in the video description to shop now on Amazon.
Pope Francis health update. Doctors release important information. Pope Francis is no longer in imminent danger of death as a result of pneumonia, doctors have said. But medics have decided to keep the pontiff hospitalized for a few more days to receive treatment. In their latest update, the doctors said Francis, 88, remains stable and has consolidated improvements made in recent days, as determined by blood tests and positive responses to drug treatments. The Vatican said the doctors had lifted their previous, guarded prognosis, meaning the Pope is no longer in imminent danger as a result of a respiratory infection. It said in a statement. However, in view of the complexity of the clinical picture and the important infectious picture presented on admission, it will be necessary to continue medical drug therapy in a hospital setting for additional days. In a sign of his improved health, Francis followed the Vatican's week-long spiritual retreat via video conference on Monday, March 10, in both the morning and afternoon sessions. Francis participated in the retreat remotely from the Rome hospital where he is being treated. He could see and hear the Reverend Roberto Pasolini, preacher of the papal household, but the priests, bishops, and cardinals gathered for the retreat in the Vatican auditorium could not see or hear him. Read more inside the 900-year-old book, which reveals when Judgment Day will be. Pasolini is delivering a series of meditations this week on the hope of eternal life. A theme chosen well before Francis was admitted to Rome's Gemelli Hospital on February 14 with a complex lung infection. The retreat is an annual gathering which kicks off the Catholic Church's solemn Lenten season leading to Easter. The Vatican has said Francis would participate in spiritual communion with the rest of the church hierarchy, but from afar. Francis also resumed his physical and respiratory therapy at the Gemelli Hospital, resting and praying in between. He has been using a nasal tube for supplemental oxygen to help his breathing during the day and a non-invasive mechanical ventilation mask at night. The Pope has chronic lung disease and had part of one lung removed as a young man. He had what was just a bad case of bronchitis when he was hospitalized last month. But the infection progressed into a complex respiratory tract infection and double pneumonia. It has sidelined Francis for the longest period of his 12-year papacy and raised questions about the future. Don't miss Vatican Crisis as Pope Francis signs off task force to encourage donations revealed Pope's death, could fulfill saints' chilling prophecy, and spark apocalypse report. Cardinal, 70, among favorites, to be next Pope as Francis still in hospital latest. We use your sign-up to provide content in ways you've consented to and to improve our understanding of you. This may include adverts from us and third parties based on our understanding. You can unsubscribe at any time. Read our privacy policy. However, Francis has still been keeping his eye on things. The Vatican said he had been informed about floods in his native Argentina and expressed his closeness to the affected population. In addition, a Vatican cardinal close to Francis spoke out on Monday to refute some negative media reports, which have circulated in his absence. The Vatican Development Office released a letter written by Cardinal Michael Czerny to one of Francis' close friends, the Argentine social justice activist Juan Grabois. Grabois had traveled to Rome to pray for Francis at Gemelli Hospital, and some Italian media reported last month that he had tried to forcibly get into Francis' 10th floor hospital suite, a claim he denied. In the letter, Czerny told Grabois that Francis knew of your presence in Rome and your daily vigils of prayer and spiritual solidarity at Gemelli Polyclinic, and I'm sure this gave him a true comfort and support. Additionally, I know that you join me in strongly repudiating the unfounded versions that have circulated in some media about alleged inappropriate behavior in the hospital, Czerny wrote. The Vatican is always abuzz with rumors, but has gone into overdrive with speculation about Francis' health and talk of conclaves, even though Francis is very much alive and in charge. The fact Czerny felt it necessary to defend one of Francis' friends suggested the rumor and maneuvering in Francis' absence had crossed a line. This Thursday, the Vatican will mark the 12th anniversary of Francis' election, the first with the Pope out of sight, but still in charge. Francis is the 266th Pope, the first Jesuit Pope, and first from Latin America. He has led the Catholic Church since March 13, 2013, after the resignation of Pope Benedict XVI.